Brian Lehrer on WNYC. So every Tuesday on the show for a few years now, we've been doing a health or climate story of the week. This began when we saw the climate getting what we thought was too little attention in the media because the climate doesn't change at the speed of the news cycle, does it? Then when the Trump administration and RFK Jr. came in with their radical overhaul plans for public health policy, we expanded it to a health or climate story of the week. As it turns out, our story in public radio and television intersects with the story in public health in that both have been marked not just by policy change, but by defunding. For this week's segment, we welcome back Katelyn Jetelina, a recurring guest and one of my favorites in this series. Katelyn writes a newsletter called Your Local Epidemiologist. An epidemiologist is someone who studies the spread of disease and what seems to cause or prevent it. Katelyn's been writing recently to explain the Hantavirus outbreak, and now in today's newsletter, the Ebola outbreak, a much bigger deal, actually, and the risks to people here. But she also had a New York Times op-ed last week that gets to the structural problem with defunding public health. It's called Our Public Health Agencies Have No Leaders. What could possibly go wrong? So Katelyn Jetelina, your local epidemiologist, always good of you to give us some time. Welcome back to WNYC.
Hi, good morning. Thank you for having me.
Let's start with your op-ed, and then I'm sure our listeners will want to hear your take on the Ebola news today, that it's spreading faster than first realized. You begin your op-ed with the resignation of the Food and Drug Administration head, Dr. Marty Makary. He was a Trump and RFK appointee, so what does his departure signify to you?
Well, this is just another departure along a long list. And I think that a lot of these leaders were very critical of the government, in some ways rightfully so, in some ways not, during COVID-19, and is just another example of mistaking, hard, unglamorous work of institutional change. He just didn't have the leadership to do it, or the ability or strategy to do it. And what makes me incredibly concerned is that all of this is playing in a background with other diseases coming more quickly, and also on top of families already feeling very abandoned by the health system and overwhelmed by medical bills.
You wrote that despite Dr. Makary's credentials as a creative physician and scientist, the FDA became less reliable and transparent under his leadership. How, for example?
I mean, how long do we have here? There is a very long list. I will say, and I said this in the op-ed, that there are some things that he did do, like integrating AI to make sure that clinical trials go faster, being able to share data more often or more transparently. But these are all overshadowed by a very long list, like I said, of that Tylenol and autism, press conference. Yep. Yeah. And stopping rare disease medications and the approval process, the whole review of a new flu vaccine from Moderna, and then reverse course. And along the way, losing countless high-quality staff members with impeccable integrity, whose job was to keep ourselves safe from diseases and safe from foods and medicines. And the consequences of these actions are just not abstract.
You do credit Makary with a few things, including the reported reason for his resignation, that he didn't want to bow to political pressure to authorize the sale of flavored vapes. You call that an admirable stand. Why do you think so? And why would Team Trump or Team RFK, make America healthy again, want to authorize flavored vapes?
I think we're seeing the influence of massive corporations and their effectiveness of lobbying, particularly this administration. We have seen their effectiveness on other things, like at the EPA and reducing or increasing pollution by reducing regulations. This is just, again, a long list. And It is. I mean, I did give him credit for backing out and not bowing to that political pressure, but it also came a little too late. There's a lot of things he did bow to that are creating the United States to really spin its wheels and even go backwards in a lot of things on health. And I am just fed up with it.
Here, here's the defunding piece that connects with defunding our institution. You wrote funding for core data systems, logistics, and community partnerships has been cut. Research funding is moving at a glacial pace. So what do you see as some of the most consequential aspects of defunding public health research or public health agencies?
I mean, we're seeing it right now play out in real time with the Ebola outbreak. Defunding USAID certainly has an impact on how this outbreak is unfolding. Defunding communications or even firing a lot of people in communications at CDC and the detrimental effect that has on the Hantavirus outbreak. We also, like I said, are defunding a lot of scientific research. In fact, the past 14 months, we stopped research on hantavirus. And so a lot of this is around preparedness. A lot of it will impact us in the short term, but it will impact us in the long term as we continue to get these disease threats that come at us and usually thrive when we are most vulnerable.
Hantavirus, the outbreak on the cruise ship, and now people are being quarantined. You write the outbreak remains contained, but there's a countdown to mid-June. What's the countdown?
That's right. So we are in a waiting game for biology to play out. One of the most nasty things about hantavirus is that it takes a long time and this is called an incubation period, for a viral particle to enter the body once you're exposed, to latch on, to replicate and then cause symptoms. In fact, it takes 42 days, which is very long. And so that countdown began, the 42-day countdown began May 11th in the United States, which lands us at about June 22nd to see if this outbreak grows among these passengers and those exposed to these passengers on an airplane.
And why this matters so much, according to the World Health Organization, in the Americas, hantaviruses can cause hantavirus cardiopulmonary syndrome, a severe respiratory illness with a case fatality rate of up to 50%. So a little background for that, why even though with so few cases and apparently contained, there's so much concern about this. There does seem to be some disagreement over how easily hantavirus spreads. Does it require close person-to-person contact, or can it linger in the air after an infected person leaves a space like COVID can? Do you understand why different takes are out there?
I do. This is a very rare disease. And so because of that, we have limited scientific information on it. We are relying on some small historical outbreaks out there. And I think we are learning in real time, and we will learn a lot from this outbreak. And you're right. One of the biggest questions is how effectively this disease transmits. We know that it transmits very well from rat to human. And we know the specific type of hantavirus also transmits very easily in close contact with other people. The biggest question is, does it linger in the air or for more causal interactions? And the reason that's being brought up is because there's a 2018 Argentina outbreak where a symptomatic patient went to a birthday party, infecting 6 other people, and one person may have only been involved in a brief passing interaction. And this really matters, not because I think this is going to turn into a pandemic, and this is why you're also seeing so much scientific debate around it, is because it really matters for contact tracing, right? To ensure everyone who needs to be monitored is monitored. And it also really matters that scientists collect the right specimens off that ship so we can learn more. But overall, the risk of a pandemic for hantavirus remains very, very small.
So let's go on to the Ebola outbreak in Congo. You cite over 340 suspected cases and 100 deaths, and now there's a travel ban from 3 countries. Briefly, what is the Ebola virus and what makes it so dangerous?
Yeah, this outbreak is incredibly sad and depressing. So the Ebola virus is basically a virus you don't want to mess with. It was discovered in 1976 and it's severe. We're talking like 25 to 90% case fatality rate. And symptoms include fever, severe headache, vomiting, but in the most severe cases, internal and external bleeding. So it is certainly something we don't want to mess with. And how things are unfolding over in Central Africa suggest that the true outbreak is much, much larger than those numbers that you mentioned. And it's going to be tougher to contain over in Central Africa. But to those of us in the United States, the risk to us currently still remains low.
And this brings us back to the defunding. You note in your newsletter that this has been spreading for a while without detection. And you ask, is this because of the cuts to USAID and global health efforts? Your answer is almost certainly yes, for a few reasons. Could you go over one or two of those?
Yeah, I can. And I think overall, like I said, this is what happens when we dismantle public health systems. Disease thrive in these sort of environments. And so I'm not too surprised that this is getting out of control. Two of the things that have happened around defunding is around USAID. USAID is was, I guess, an incredibly helpful organization. And in situations like Ebola, and in fact, the last Ebola outbreak, USAID helped train communities on safer burial practices and help set up airport screening to prevent systematic travelers from boarding planes. And then also there's defunding and not defunding and cutting our CDC capacity, right? CDC typically works alongside affected countries and the WHO to expand testing, to coordinate in the early response, to help provide technical assistance. And that is all very much in question right now as this outbreak plays out.
Do you see ideology driving these cuts as opposed to, or in addition to, a desire for the government to save money?
Oh, absolutely. There's ideology. I think that it's very clear that many of these cuts, sure, some of it was to save money, but public health was completely targeted because of COVID-19, I think. And, there needed to be reform. I say that in my New York Times op-ed, that institutions were built for another time, but burning down the house is not a solution given what is happening in this world and what Americans need for their safety and security.
We're in our membership drive, as you know, and we can make up for some or hopefully a lot of the defunding if, we have enough meaning to our listeners that they donate and become members or increase their memberships. What is the public health community doing to compensate? What can it do for the defunding there? You can't, go on the radio and say, hey, help us survive in the way that we can.
Right. And I heard that you have beach towels connected to your drive too. But, I think that what we've been seeing is that states are really stepping up. We have these up in New York, the Northeast Regional Collaborative, really trying to soften the blow of the cuts of public health. But ultimately, public health is funded by the government. It is inherently political. And we are going to continue to see cuts and the ripple effects to this. There are some of us, me included, trying to fill the gaps outside of government, trying to figure out what a for-profit, mission-driven model can look like so we can sustain these cycles of panic and neglect. But also, ultimately, this means that we need to go to the voting booths and really elect leaders that want to protect our health in a meaningful way, that are willing to strengthen these systems instead of destabilize them. And that's ultimately the power of the people.
That's our health and climate segment, our We Bring the Science segment. For this week, we do one every Tuesday. Katelyn Jetelina, a recurring guest, writes a newsletter called Your Local Epidemiologist. Thank you so much for joining us again.
Thank you for having me.